Hi, good morning. This is Dr. Tom Kang from Puget Sound Periodontics. And this short video has been made to accompany the instructions for patients regarding oral sedation that you've elected to have as part of your treatment in our office. So first, let's talk a little bit about what oral conscious sedation is. Oral conscious sedation is provided to patients who are concerned about being fearful or having high anxiety when in the dental chair. Oral conscious sedation is not putting our patient to sleep. If patients are interested in that, we'll talk about this a little bit later in the video. This video, as well as this form, should be shared with the driver who will be bringing you to and from your visit. Your driver needs to be a close friend or family member, someone capable of providing you with support both after the visit, but also in the administration of your postoperative medications, as well as following through with post-op instructions that have been provided to you by our team. It's important that you disclose all the medications that you're taking, and please do so prior to taking any of the medications which we will be giving to you in the office for your oral sedation. You want to avoid using St. John's wort or grapefruit juice for the week prior to your visit, as this can enhance the sedative effects of the medications that we'll be providing to you. Please make sure you've read and or received all necessary consent forms prior to arriving for your appointment. These should have been given to you or emailed to you before your visit by your treatment coordinator, and if you've not gotten those, please make sure that you reach out to your treatment coordinator to get those sent to you. Okay, this form will be sent to you before the visit, and on it we will list your actual arrival time. So this can be sometimes confusing. Your surgery time might be 8 o'clock, but your arrival time should be 7 a.m. So please be sure that you know both the date and time that you'll be arriving for that visit. When you arrive, you'll be asked to make any payments that haven't been made at your initial scheduling appointment. The consent forms will all be signed, and then you'll be escorted back to one of our private operatories where we will make sure that you're comfortable. We'll give you a warm blanket. We'll put a little protective eye covering in place. We want you to avoid using your cell phone or any kind of stimulating activities that might interrupt with the way that the medication works. It's important that when you arrive, you've done so on an empty stomach. And so a good rule of thumb is avoid eating or drinking anything after dinner the night before your visit. We want you to avoid any coffee or stimulants in the morning. These medications are absorbed through the digestive tract, so anything that you've got sitting in the stomach may interrupt with the normal use of these medications. You should not plan on driving for 24 hours after taking any of these medications. And this is very important. If a narcotic was prescribed for you, like oxycodone for instance, you must delay taking it for 24 hours after the administration of your sedative medications. On our comfort protocol or our pain management protocol, which is in a separate document, that'll go over how you should be taking these medications to make sure you'll be comfortable after your visit. Your transportation person should be prepared to remain with you for up to 8 hours after your treatment was completed, just to administer meds, make sure your consciousness is returning to a normal level, and so on. So again, before your visit, make sure you've got your consent form signed, any medications or prescriptions that you're going to be taking have been picked up, and your payment arrangements have been made. Finally, what we're going to be doing is having you sign a consent form like this. The medications that are administered are halcyon and hydroxyzine, and again, our goal is not to put you to sleep. Most of our patients do lightly nap through the visit, but would be able to respond to verbal commands that were given to them. There are alternatives to oral sedation, which include no sedation, so we can just numb the area, IV sedation, and general anesthesia. Those last two, if they're of interest to you, would be provided by an anesthesiologist that we work with. And while rare, you should know that sedative medications all come with some inherent risks, although the likelihood of these is very low. If during the treatment we find something unexpected, that procedure may need to change, and you're authorizing us to make these changes if, in the best use of our professional judgment, we find this is necessary. Now, this is rare, but we do make sure that we want to make sure that you're aware that that sometimes is the case. Finally, again, and just reiterating, both your driver needs to be available to you for up to 8 hours after the visit, and you should know not to operate a vehicle for 24 hours after the procedure. Okay, well, we look forward to seeing you on the day of your visit. If you have any questions, please reach out to your doctor. These instructions can always be found on our website by going to the patient instructions section of our website. So go to PugetSoundPerio.com, patient resources, and you can find them listed under patient instructions. Please review this video with your driver as well. Thanks very much.